A very good day, dear friends. Myself, Dr. Kaustav Chakraborty. I am Associate Professor and Head, Department of Psychiatry, College of Medicine and J.N.M Hospital under WBUHS, Kalyani, Nadia. Today, I am here to discuss different concepts of stress and how to manage stress. I think in modern world, this has become immensely important to know how to manage stress because we are regularly faced with stressful life situations in our family life, in our workplace, and every sphere of life. And a resultant of that, we suffer from anxiety, depression, and other various mental conditions, which on some of the occasions may lead to very bad outcome like suicide, which is not at all desirable. So therefore, we need to know how to manage stress in our daily life. So to begin with, I would like to give you some situations and you have to tell me which one of this is stressful to you. The situations goes as follows. You receive a promotion at work. Your car has a flat tire. You go to a funny party that lasts till 2 a.m. Your dog gets sick. Your new bedroom set is being delivered. Your best friend and his wife come to stay at your house for a week, and you develop a bad case of viral fever, which is very common nowadays. Now, if you look at the situations, there are some good thing that is happening to you, like you are receiving a promotion, you are going to a fun party that lasts till late in the morning, and your new bedroom set is being delivered. So these are the good things. But friends, this situation can also be stressful for a particular individual. So stress is a very subjective thing, and it depends on the internal resources and reserves of particular individual, which situation he will perceive as a stress. So for a promotion, a person may have to relocate. A person follows his daily routine very strictly, but a fun party that lasts till 2 a.m. may exhaust his internal reserve. A new bedroom set is being delivered. That means again he or she has to redesign his house, and he must have spent a lot of money for that, and for which he might come under financial stress. So depending on the situation, each of these thing can become stressful for an individual. So as I've already told you, all of this can be major stressors for a particular individual. Now, only one group of people will have no stress. That means that is only after death we will have no stress, because life can't be without stress. You have to face stress in your day-to-day life, and you need to know how to tackle that. So what is stress? You need to define stress. The definition of stress was given by Lazarus in 1984. He defined it as a condition which is experienced when a person perceives that the demand that is from the society, the societal demand, exceed the personal and social resources that the individual is able to mobilize. So when the internal reserve is exhausted and person cannot cope with the external demand or even internal demands, then he is bound to suffer from stress. Now, stress is the body and mind's response or reaction to a real or imagined threat or event or a change. So the thing may be even imagined. It may not exist at present, but it can be an imagined threat also. Like, I need to deliver a lecture tomorrow. So it might be stressful for me because it is not happening in reality. I just anticipating it and experiencing stress. The threat, event, or change are commonly called stressors. Stressors can be internal, like thoughts, belief, attitudes, or external, like loss, tragedy, or a change. So it can be internal stressor or external stressor. Now, definition of stress it conveys both information and vagueness. Now, I've already told you that it is defined as a condition in which there is a marked discrepancy between the demands made on an organism, in particular case, this particular case is human, and the organism's capability to respond. So stress occurs when the pressure is greater than resources. S equal to P more than R. Pressure is more than the resources. So that is how it is defined. Now, what are life events? Life events are discrete changes in life conditions that are consensually recognized as entailing some degree of distress, challenge, or hazard by the individual and member of his or her social group. So these are the little things that you face in your daily life, which is recognized by the individual or his social group as something which is threatening, distressing, or challenging. So in numerous researches, it has been shown that these daily life hassles, when they are put together, or their cumulative capacity of causing stress to an individual is much more than an acute quote unquote stressful event like a financial loss, like losing somebody near and dear ones, like breakup in a romantic affair. So those are one time acute events, but cumulative effects of these daily life hassles are much more, and an individual may be more vulnerable to these daily life hassles if he or she has to face those things regularly. Now, these life events have been historically described as being exit or entry events, loss events, desirable or undesirable events. Now, there are chronic difficulties. Brown and Harris defined this as a problem lasting for more than 4 weeks. These are chronic difficulties. Daily hassles or uplifts that I was telling you, mini events that require small behavioral readjustment during course of the day. For example, traffic jam, that itself can be stressful. Chronic stressor like job stress, difficult marriage. Animal models showed that inescapable shock, force. There are various animal models to show that these things like life events, daily hassles, mini events can be stressful for a living individual. There are animal experience where animals like rats were given inescapable shock. They are forced to make swim with their tails suspended. So these are famous experiments with animal where it has been shown that by repeatedly giving shock, where the animal has no opportunity to exit that situation, ultimately gives up and enter into a state of demoralization or hopelessness. Just a minute. Yeah. So the process of stress starts with the stressor, which is an activating event. Then there is a perception of threat. How do we appraise that situation? If we appraise it as a dangerous thing, or we appraise it as a neutral thing, and then it is followed by an emotional reaction. Emotional reaction can be of despair, of distress, of low mood, of anxiety, anticipatory anxiety, overwhelm, sense of overwhelmness. So there can be multiple emotional responses. Stress is very much prevalent in all the societies, and India is no exception to that. About 89% of the population in India say that they are suffering from stress compared to the global average of 86. And nearly 75% of respondents here do not feel comfortable talking to a medical professional about their stress and cite cost as one of their barriers. So Indians are very reluctant seeking professional advice for their stressful life situations, and even if they develop some kind of psychiatric disorder as a resultant of that stress. Nearly 9 in 10 Indians suffer from stress. In fact, the recently released findings of the 2018 Cigna 360 Wellbeing Survey conducted by Cigna TTK Health Insurance showed that stress levels are higher in Indians compared to other developed and emerging countries. For example, United States, UK, Germany, France, China, Brazil, and Indonesia. And this finding is nothing new or nothing amazing, because We know that India is a hugely populous country, and here ignorance, uh, the financial status of the individuals are very poor, and education level is also very poor, which result in huge burden in terms of work, huge burden in terms of family conflicts. So that result in huge amount of stress in Indians. Stress is universal. It is present everywhere in the environment, in work environment, in school, in the family, in between friends, and perception is a common source of stress. That person has to appraise the encounter as threatening, and a negative feeling or bad habits may also cause stress. And but some degree of stress is not all bad, because that is what we experience during our examinations, when we have to sit for a major examination like our board examinations of class 10, class 12. Some amount of stress and anxiety is good, but excessive of it can jeopardize the outcome of the exam. So stressors are the cause of stress. Any environmental condition that places a physical or emotional demand on the person will cause stress to that person. NIMH, National Institute of Mental Health, notes some of the more common stressors, like increased academic demands, being on your own in new environment, change in family relations, financial responsibilities, changes in your social life, exposure to new people, ideas, and temptations, awareness of your sexual identity or orientation, and preparing for life after graduation. So these are the few examples when we are bound to experience stress, and that is almost universal to all of us. So how stress is caused? Now, during our MBBS days, while studying physiology, we all have studied this. There are two protective physiological mechanisms. One is alarm reaction and one is adaptation. Alarm reaction is that when we are confronted with a threat to our safety, our first response is physiological arousal, that our muscle become tense and breathing and heart rate become more rapid. And this serves us well when the threat is a proverbial bull in the field rushing towards us. We either fight with it or we just flee from the situation. And the second one is adaptation. The adaptive mechanism allow us to cease responding when we learn that stimuli in the environment are no longer a threat to our safety. For example, when we first spend time in a house near a railway line, our response to trains hurtling past is to be startled, as described above. Then we used to get accustomed to that situation, and no longer we get startled by that sound of the train. So what is eustress? Sometimes stress can be positive also, and that is called eustress, which has the following characteristic. It tends to motivate a person. It infuses energy into a person. It is usually short term, and it is perceived as within our coping abilities. Like when I am given a task of teaching somebody, or when I given a task of presenting in a webinar, which is within my ability, that gives me a sense of self-worth. That can be a eustress for me, and it feels exciting and can improve one's performance. Distress or negative stress has the following characteristic. It causes anxiety, and anxiety comes with a lot of autonomic symptoms, like increased frequency of micturition, palpitation, sweating, sometimes dizziness, reeling sensation, blurring of vision. It can be short or long term, and it is perceived as outside of our coping abilities. It definitely feels unpleasant, and decreases the performance level, and it can lead to mental and physical problems. Now, there is a line between eustress that turns you on and distress that wears you out, which is often difficult to distinguish. Now, people's evaluation of stress and performance are necessarily subjective. It is very important that particular situation which may be stressful to me may not be stressful to you. and healthful stress levels vary greatly among individuals. So it depends on the internal resources, internal reserve, that at what threshold I will experience a particular event as stressful. Now, there is a biopsychosocial model of stress. The multi-determinant model proposed by Mayer brought together intrinsic and extrinsic factors and described life events and initiating or precipitating. George Engel in 1977 coined the term biopsychosocial based on general system theory and emphasized on integrated approach of developmental, psychological, social, environmental, and biological factors. So this is a very integrated model in which he proposed that a particular individual is vulnerable to stress by virtue of his genetic makeup, by virtue of the environment in which he is brought up in his infancy or childhood, by virtue of the influences that he or she receives from the peer group, for his family, from his family members, and that creates the cognitive schema of that particular person, how he appraises a particular event, whether in a negative way or in a positive way, how much internal reserve that he or she has, and ultimately when faced with a stressful situation in a adult life or adolescent life, how will he respond to that particular situation. So this is called the biopsychosocial model. Now this is a schematic diagram of this biopsychosocial model. The central processes that are involved are biological, cognitive, affective, and somatic. Somatic are the different stress hormones that are released in our body, and acute phase reactant that are released in our body in response to stress. Affective component that is controlled by the limbic system. Cognitive schema, again a frontal lobe has a major role to play in it, and there are feedback mechanisms, afferent and efferent feedback, and ultimately the peripheral processes by which the stress reaction is ultimately expressed. And these are the factors, social factors, which impinges on the body, and behind it is the genetic predisposition that predisposes a person whether he or she will develop a particular psychiatric disorder in question, like anxiety or depression. These are the immunological neuroendocrine mechanisms. In response to stress, there is increase in interleukin 1, interleukin 6, and TNF alpha. These are acute phase reactants. There is increase in corticotrophin releasing hormone, ACTH, GnRH level decreases, so there is loss of libido. There are behavioral effects like disturbances in sleep and appetite, sexual prowess decreases, and there is this cortisol released from adrenal glands. There are a lot of activity that starts happening in our body, and these high state of hypercortisolemia ultimately affects our brain, and the first organ is to be affected is the hippocampal cells that stores our memory. So people often come with the complaint of memory loss. That is one of the earliest complaint of a person who is facing with chronic stress. Followed by irritability, lack of sleep, disturbed appetite, and all those things. Now, what are the symptoms of distress? We all know these: headache, fatigue, gastrointestinal problem. This is very common in Indians. Features of IBS or irritable bowel syndrome, hypertension, heart problems such as palpitation, inability to focus and concentrate, sleep disturbance, sweating palms, shaking hands, anxiety, and sexual problems. So a myriad of problems. And the conceptual model linking stress exposure to poor health. This is just you have a look at this. I don't have to explain this. As I just told you that biopsychosocial model. There are external stresses, there are internal stresses that impinges on body and give rise to stress response. A myriad of changes take place in our body that affects our heart, lung, brain, every in fact every organ, and in long term can give rise to physical health problems like diabetes, hypertension, and psychiatric problems like anxiety and depression. So there are three disorders in psychiatry which are directly linked to stress. They are acute and transient psychotic illness and PTSD and acute stress disorder. Uh, this acute stress disorder or PTSD follow events that are beyond the range of normal human experience. Any life-threatening event or life-altering event can give rise to PTSD. Symptoms following acute medical illness, chronic illness, community stress, job stress, and exposure to those who have been traumatized can give rise to acute stress disorder. People from the general population whose worst event is a life event such as chronic illness, marital discord, or unemployment on average have more PTSD symptoms than people whose worst events are is traumatic. The symptoms of PTSD are emotional numbing, avoidance, and high state of hyper arousal. So people produce startle reactions. These life events are more likely to produce PTSD if they are severe, prolonged, repetitive, life-threatening, isolating, conflict with one's sense of self, and physically or psychologically demeaning, damaging to their support system. The susceptibility factors are like female gender and low IQ. So PTSD is more common with people with low IQ and females. Genetic factors can influence risk of exposure to some form of trauma, perhaps through individual differences in personality that influence environmental choices. Acute transient psychosis follows typical events like bereavement, unexpected loss of partner or job, marriage, or the psychological trauma of combat, terrorism, or torture. Uh, we commonly say that the person has broken down and and the level of stress reached the threshold where psychotic breakdown was inevitable, and the first psychotic symptoms must occur within 2 weeks of the event. However, there is limited evidence available which indicates that a substantial proportional may arise without associated stress also. So it is another condition which is directly associated with stress. Stress and adjustment disorder, it arises always as a direct consequence of the acute severe stress or continued trauma. Stressful event or continuing unpleasantness as primary and overriding causal factor, disorder would not have occurred without its impact. So while treating an adjustment disorder, you always have to remember that you need to address the ongoing stressor. Otherwise, it will be very difficult for you to cure that person. What are the stages of stress? Now, the first one is alarm stage. The organism identifies an environmental demand as threatening, which is manifested by increased heart rate, increased respiration, decreased temperature, and increased stimulation of adrenal gland, which produces an adrenal rush. Followed by resistance stage, where organism gathers resources to cope with the demand, and your friends, family, and co-workers may notice changes in you before you do so. So it is more often than not the person is being brought by family members or friends who notice some behavioral changes in that person, who becomes more irritable or anxious or have decreased sleep and appetite. So it is important to examine their feedback to make sure you do not reach that state. Now, behavioral indicators include lack of enthusiasm for family, school, work, or life in general. The person become withdrawn. There is change in his eating habits and sleep habits. Person become easily angry or feel excessively fatigued. There are confusions, poor attention concentration, poor problem solving capacities, and person become hyper vigilant. Uh, at times, he may become tearful, may feel fearful, anxious, panic at times, may experience guilt, depression, become agitated or overwhelmed. So all this can happen, not necessarily the same individual, but these are the common symptoms, and ultimately person reach the exhaustion stage, during which the stressor is not being managed effectively and the body and mind are not able to repair the damage. And manifestations during exhaustion stage are digestive disorders, social withdrawal, headache, tension, insomnia, loss of temper. So these are very common when a person is facing with continued stress. These are the disorders that can happen due to stress. I have already enumerated the first three. Depression is another common one. Schizophrenia, substance use disorder, particularly when the person is trying to cope with the ongoing stress in a maladaptive way by taking recourse to addictive substances, particularly alcohol or cannabis or heroin. He can develop anxiety disorders in the long run, and psychosomatic disorders are also very common, in which there are multiple medically unexplained somatic symptoms, which have no core or no evident organic basis. So what are the management strategies? Now we have come to know something about stress, how it manifests, what are the symptoms, what are the stress stages, and what are the changes that are happening within the body. So we have some knowledge about those things now. Now we need to know how to manage that is the most important thing. So stress management is a decision making process. When we are under stress, there are three major ways we can deal with it. These are known as ABC of stress, and either we need to alter it, or we can avoid it, or we can accept it. These are very simple. Either you alter the stressful situation, or you just avoid the stressful situation, or you need to accept the situation as it is. Second thing, you need to build your resistance. Building your resistance means that you need not to fight with the stress all the time, but you need to build your internal reserve, and you need to change the perception, how you look at a particular situation. That is done by the cognitive therapy that you need, which alters your way of looking at a particular event, and addresses your cognitive biases. So alter the stress means removing the source of stress by changing something, like problem solving, communicating directly with that person if a person is causing stress, organizing things, planning, and time management. These are the most common technique for altering stress. Time management is a very essential tool in our current times, where we are bombarded with multiple works, and we are more often than not are doing multitasking. So you need to do time management, where you have to plan things well beforehand, and you need to uh, jot down your work which you are going to do today, and at the end of the day, the works which are left, you shift them to the other day, and you don't bring your office works to your home, and so that it does not interfere with your family life. So these are very important things in today's world. Now, how to avoid uh, those stressful situations? Avoidance means removing oneself from the stressful situation. To conserve energy, people sometimes need to walk away or let go, say no. I won't do that thing. I won't be there because I have other engagement. You need to delegate things to other people. You need to decentralize things. You need to withdraw sometimes, and you have to know your limitation. If you don't know your limitation, and if you push yourself, then you are bound to feel stressed out at some point in time. So, and saying no is another important thing. You need to know that you can't please everybody in your daily life, because pleasing somebody needs some amount of energy spending from your part, and ultimately you will be devoid of your reserve. Accepting means equipping oneself physically or mentally for stress. So This is also a strategy where you need to accept, where you can't avoid, where you can't fight. You need to accept things like it is. You need to build up your internal reserve. It can be done physically through proper diet, regular aerobic exercise, and systematic relaxation technique. These are the lifestyle modification techniques which are often advised by doctors, nutritionists, health experts, and it can be also done spiritually through meditation, pranayam, yoga, prayer, worship, faith, building faith in God, or some supernatural power, and your commitment towards other people, family members. Mentally, you can practice positive affirmation, take out time for your mental health, and getting clear about goals, values, priorities. Sometimes you need to talk to yourself. That is called auto suggestion or auto counseling. It can be done socially by building and maintaining support system of friends, family members, investing in relationships, clearly communicating your needs, and understanding needs of other people, and building intimacy with people. So these are the ways and means how you build your internal reserve, so that you can put up a resistance when you are faced with a stressful situation. The last thing is to change. You need to change the way you perceive the situation or yourself. Changing unrealistic expectation or irrational belief is a good start. You need to always cross check your thoughts and beliefs. uh, you can have erroneous belief and cognitive biases, those are very common. I will not go into detail about the cognitive biases. That cognitive biases are corrected through cognitive behavioral therapy, which is a well established mode of treatment of depression and anxiety these days, and practiced by psychologists all over the world. You need to build your self-esteem and cultivate a positive attitude. You need to redefine the situation in a less stress-provoking way. That is, isn't it funny, or isn't it grand, instead of isn't it awful, increases these redefining situation increases your stress resistance. So you need to stop catastrophizing the situation all the time, and you need to have a positive outlook to a particular situation. So, what are the other techniques? You need to avoid unnecessary stress. You need to practice more patient, and you need to control your responses. You need not show knee-jerk reaction to all the events, or all the need not show knee-jerk reaction to every life events. You need to set goals, like what you need to do in your life. It can be daily life goals, or weekly, monthly, 1 year, 5 years. So there are some long-term goals, there are some intermediate goals, and there are some short-term goals, and you try to achieve those goals by taking small steps. Don't take long strides and fail in your endeavor in achieving those goals. So you need to establish priorities. You need to plan ahead, make a to-do list in order of importance, and do most important things from those lists. And at times you may need to drop some of those things. Take your time out, spend a few minutes each day alone to break routine or socializing. Uh, if you continue to follow a particular routine all the time, at times that can be quite boring. So set aside time each week for recreation is must, and that should be done. And you need to exercise regularly, because with exercises there is a release of endogenous opioids, which elevates our mood and keeps our body healthy. Have faith. You need to meditate. Meditation means you need to concentrate on a particular thing. That can be a particular theme, or particular god, goddess, or you can focus on a point. So you can meditate in multiple ways. You can do deep breathing exercises that will come later on my presentation, and need to think positively, that you need to maintain a positive attitude, which give you more control, because negativity wastes energy, and practice I can rather than I can't. That means you need to build up a positive attitude towards your life, and you also need to have a good sense of humor. You need to laugh quite frequently, and always don't make a grumpy face. Sometimes you need to laugh at yourself, and who it is being said that he who laughs, he lasts. So you need to develop good communication skills. You need to talk over your concerns and feeling with a friend, family member, and professional. It is always better to seek help rather than keep a particular thing within yourself, and let it get big, and ultimately explode, so that you are mentally and physically devastated. Talking it out relieves stress and gives you insight. You need to listen to others problem also, otherwise no one will listen to you in this fast world. And also you need to consider every suggestion with an open mind. Don't be rigid in your thinking, be flexible. If you need to undergo some sort of counseling or psychotherapy, you need to be receptive and flexible to what your counselor or psychologist says. Don't resist change if it is needed. Sometimes we need to accept changes in our life, make a choice, and move on. If your problems are too much to discuss with a friend or family member, or you feel they would be too much of a burden, you need to get professional assistance from a psychiatrist or a psychologist. Remember, you are not alone. There are people to help you, but you need to seek that help. There are some ways of handling the stress, and one of it is challenging the cognitive biases through cognitive restructuring. This is the way to change one's thought process, that negative way of thinking, and one has to challenge the way one thinks. We all have some sort of cognitive distortion in the form of arbitrary inference, selective abstraction, overgeneralization, magnification, minimization. These are terms, terms which is there in psychological medicine, and these are also known as cognitive biases. And you need to replace these automatic negative thoughts with more rationalized positive thoughts, and this is done by a technique which is called cognitive restructuring or cognitive behavioral therapy. There are simple relaxation practices, for example, biofeedback, prayer, meditation, visualization or imagery, and progressive muscle relaxation. These all are very much helpful. Relaxation techniques are exercises that are done that reverse the physical stress response. There are 4 common elements to learning most of the relaxation techniques. You need to have put yourself in a comfortable position. The environment should be quiet, and need to concentrate on a particular object, and your attitude should be passive. Now, biofeedback is a relaxation technique which needs a machine called biofeedback machine, and it's a process of gaining greater awareness of many physiological functions, primarily using an instrument that providing information on the activity of those same systems with the goal of being able to manipulate them at will. Now you sit in front of this machine, and some electrodes are being placed on your eyebrow, skin. That it monitors your muscle movement, ocular movement, skin conductance, and EEG at times, and so all those input are delivered into the computer, and computer assess, and also it measures your blood pressure, pulse, and computer gives you a feedback that whether you are tensed or not. And there are 3 colors: green, red, and yellow, and those are indicators that if it is red, that you are stressed, and then you need to relax yourself so that the color changes to green and yellow. So by giving it a feedback, it helps you in controlling your physical parameters, and helps you to come to a eustress situation. So it is quite helpful and available in most of the medical institutions. Meditation is a practice in which an individual trains the mind or induces a mode of consciousness, either to realize some benefit. So meditations are definitely helpful, although there are no RCTs in that way. But they are lifestyle modification techniques which people have found to be very much helpful. There are yogas, Patanjali Ashtanga Yoga Sutra, which entails the principles of ethical discipline, rule, physical postures, breathing control known as pranayama, withdrawal from the senses, one-pointedness of mind, meditation, samadhi, which is often described as the union of self, Atma, with the omnipresent Brahma. Deep breathing, this is the one of the most easiest way to relax yourself. It involves slow and deep inhalation through the nose, usually to a count of 10, followed by slow and complete exhalation. For a similar count, the process may be repeated 5 or 10 times and can be done several times in a day. And over a period of 2 to 3 months, it gives a desirable result where patient is able to concentrate in a better way, able to control his or her anger, and feels much better emotionally. Progressive muscle relaxation is another technique which is often practiced by psychiatrists and psychologists, and patients find it very relaxing and beneficial for their anxiety and depression problems. This involves alternately tensing and relaxing the muscles. A person using progressive muscle relaxation may start by sitting or lying down in a comfortable position with eyes closed. The muscles are tensed for 10 seconds and then relaxed for 25 seconds sequentially through various parts of the body, and then whole PMR session may take approximately 30 minutes. The initial session is supervised by the therapist, and ultimately the patient can practice it alone at home. Self-hypnosis is used extensively in modern hypnotherapy. There are 4 components to it: motivation, relaxation, concentration, and directing. However, not all the therapists are trained in self-hypnosis. Time management is one act or process of planning and exercising conscious control over the amount of time spent on specific activities, especially to increase effectiveness, efficiency, and productivity. As I've already told, time management should be an integral part of our day's work. It helps in generating free time for us so that we can entertain ourselves, we can exercise, we can spend time with our family, and we can socialize. The main theme is to create an environment conducive to effectiveness. You need to set your priorities. You need to do ABC analysis, Pareto analysis, or 80-20 rule. Which things you need to do today, and which things you can do tomorrow. You need to carry out activities around those priorities and the related process of reduction in time spent on non-priorities. Problem solving is another technique which we can use to deal with stress. It refers to a state of desire for reaching a definite goal from a present condition that either is not directly moving toward the goal or is far from it, or needs more complex logic for finding a missing description of conditions or step towards goal. Now, there will be problems. There will be problem in family life. There will be problem in social life. There will be problem at workplace. We need to cross that hurdle by solving our problem, not by maintaining that problem for a long time, which will increase your stress level. Assertive communication. Now, assertive communication is a way of dealing with stress. It says that you have the right to act in ways that promote your dignity and self-respect, so long as others' rights are not violated in the process. So you need to communicate assertively. You need to communicate your feelings, your choices, without hurting the person in front of you. By assertively expressing yourself, your beliefs and needs, you increase the chances of control through decision making, greater self-esteem, and you earn more respect from others, and which enhances the relationship in turn. But you need to remember that you don't hurt the other person in that process. That is very important. So that differentiates it from arguing or quarreling with others. The components of assertive communication is that right to be treated with respect, right to say no and not feel guilty about it, right to experience and express your feelings, right to take time to slow down and think, right to change your mind and right to ask for what you want. So it actually you ventilate your feelings by assertive communication, and the pent up feelings, as we know that if you keep your feelings within yourself, it ultimately gives rise to distress, and in long run can cause anxiety and depression. So what is the pharmacological management of stress? Yeah, definitely stress can be managed with pharmacological agents as well, because stress, although is an entity, can give rise to myriad of physical conditions and psychological conditions like anxiety and depression. So we have benzodiazepines, which are anxiolytic, like alprazolam, clonazepam, lorazepam, which can be given at lowest possible dose for the shortest possible time to tide over the crisis. However, with long-term use, people can develop psychological dependence on them, and if taken in heavy dose, they can cause fall fracture, particularly in older people. And if withdrawn suddenly, they also can cause withdrawal symptoms. Situational anxiety may also respond to as needed treatment with beta adrenergic and antagonist like propranolol. It works very well for performance anxiety. Over the long term, most anxiety disorders are most appropriately treated with antidepressant drugs like selective serotonin reuptake inhibitors, and commonly and most common of the group is escitalopram. Stress causing syndromal depression also would require antidepressant drug. It can be SSRI or SNRI. The use of drug therapies in the management of acute stress reaction and chronic stress-related disorders has emerged as understanding of the pathophysiology of this condition has become better understood. The general approach to treatment has evolved from the use of predominantly rapid-acting sedative agents for the treatment of acute anxiety attacks to the more frequent use of agents to control the underlying anxiety disorder and ameliorate the condition in the long run. So clonazepam. So I won't go into the details. Paroxetine, the SSRI. How to stay healthy? So these are the lifestyle modification techniques that you need to emphasize whenever a patient enters your chamber. Along with these non-pharmacological techniques and pharmacological therapies, you need to avoid regular use of alcohol, cigarette, and nicotine products. You need to avoid regular use of sleep medicines. You need to avoid junk foods, mutton, excess edible oil. You need to exercise regularly for at least 30 to 45 minutes. You need to maintain a good family and social life. Keep on smiling, don't be irritable, and always do have holidays and go for an outing. That helps in managing stress. When you need to seek help, this is very important to know, because we wait until it is very late. If you are losing temper very easily, you remain irritable, you have disturbed sleep or appetite, and you are making frequent mistakes at work, you are forgetting things, you become excessively fatigued, and you are taking recourse to alcohol or other substances, then it is definitely the time you need to seek help. So what we learned from this session is that stress is universal. Stress will be there, but stress is not all bad. There are some good elements to stress, but if it is continuing, if it is becoming chronic, and if it is overwhelming your internal reserves, then it is definitely bad. Stress is associated with physical and mental health problems. This is a well-established fact. It can be managed if you learn to know how to manage stress, and professional advice should be sought if you are not able to handle it effectively. So with this, I would say all of you to relax and think a bit about stress and its management, how important it has become, and nowadays, particularly in the aftermath of COVID pandemic. So you please stay healthy, follow healthy lifestyles, and whenever you need to seek help, please to seek it. Don't hesitate. Thank you all.